Good morning. Good morning, ladies and gentlemen, and welcome to the Visionaries breakfast. Are we fortunate or what? I think it's a good omen that the snow fell yesterday, not today, so that we could all be together. And I've learned in the business of disseminating news over the years that you do have to look for the good side in stories. And so I was thinking this morning of all the good sides to yesterday's storm, that the kids were happy because they got a snow day. Moms and dads, of course, on the other side were saying, oh no, not another snow day. But the snowplow operators, the ski operators, the snowmobile operators, and we set a record. And isn't it fun setting records? I say let's set a record this morning. Ladies and gentlemen, you're here because the people who are chairing your table identified you as visionaries, people who see problems as opportunities, who find solutions when others can't see them. You're what we call visionaries, and you've been behind so many movements in this community where we've recognized that there was a problem that had to be fixed. And this morning, you're going to learn about a problem that must be fixed. Frankly, it's overdue. But we've come out of the shadows on mental health. And so this morning, I hope we can make this morning about hope.
I know what we need to do.
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 We know what we need to do, and it starts with hope.
It starts with hope.
It starts with hope.
It starts with hope.
With hope.
Hope.
With hope.
Hope.
I hope you'll join us.
Ladies and gentlemen, we're going to learn about the needs of the mental health unit at the Queensway Carleton Hospital. And I'm going to invite the Department of Chief of Mental Health Unit, Dr. Jerry McNestry, to join me on stage, along with our Chief of Staff for the Ottawa Queensway Carleton Hospital, Dr. Andrew Falconer. Andy and Jerry, if you can come and join us up here. You're all laved up. Your mics are ready to go? Good.
Yep.
I want to start by asking Jerry to give us an update on how things have changed in the community in regard to mental health since it's come out of the shadows and now people are, thank goodness, seeking help where often in the past they would suffer alone.
So I think over the past 5 years, stigma, I think, is beginning to be addressed and to decrease, but the effect of that for us is that whereas in the past 5 years, the number of visits to our emergency department have increased by about 8%, the number of visits from people with mental health and addiction issues has increased by about 28%. And the number of consultations that myself and my colleagues do as psychiatrists in the Emerge has gone up by 46%, which would indicate that people are coming forth more frequently and they're sicker. Generally, I think the trend is for that to continue. It shows no signs of slowing down. And in the future, I think, although the general increase will continue, there will be a particular increase in the older population, which the number of people in our catchment area over 65 is going to increase exponentially, which will lead to different challenges.
And here's the thing that I think will be informative to many who are here today, and certainly I was unaware of it, is that we think pretty much in this town of the Royal Ottawa as being the mental health center, and yet it is our hospitals, including the Queensway Carleton, that are the ones that deliver emergency treatment in particular, and that it's a cornerstone service of the Queensway Carleton Hospital, Jerry.
Yes.
So that Queensway Carleton Hospital has a mental health program. Seems to be one of the best kept secrets in Ottawa, actually. Everywhere I go, I learn that people aren't aware of our program. In fact, we've had a mental health program since the hospital opened in 1976. And some of the services we deliver are outpatient consultation services where your family doctor can refer you to see a psychiatrist or a social worker or a psychologist, whichever seems appropriate. We also provide a day hospital service where patients can come in and get cognitive behavioral therapy and other sorts of therapy that help them cope with everyday problems in their life. We also provide a liaison service where we provide consultations for Carleton Place Hospital and Arnprior Hospital to help them with their mental health populations. We have the busiest emergency department in Ottawa, and that's really the main portal of entry for people with acute problems, like an acute breakdown or major stresses or anxieties. And that's one thing that differentiates us from the Royal Ottawa. While the Royal provides many excellent services to our community, they don't provide an emergency service. So folks with acute needs really need to come to our hospital in the West End to get their needs met. In addition, we have an inpatient psychiatry unit. This is a unit where it was built in 1976, and it wasn't purpose-built to be a psychiatry unit. It was actually built to be a medicine unit, and they've retrofitted best they can to serve the mental health population. But it doesn't have a lot of the functionality that we need to really provide good care to mental health patients. We're a Schedule I facility, which means that we have the ability to hold people under the Mental Health Act on a Form 1 against their will. With that comes the responsibility to make sure that they get good and safe care at our hospital. And it concerns me that in our inpatient unit, looking at just the way the rooms are set up and the way the geography is set up, that it's really our major issue in trying to provide that care.
Huge issue. I wonder if you could explain the collaboration that takes place between the Queensway Carleton Hospital, the Royal Ottawa, and other healthcare facilities in the community.
Sure. So Queensway Carleton Hospital, as Andrew said, is a Schedule I hospital, provides acute care to people with mental health and addictions issues. We are one of a number of Schedule I hospitals in Ottawa. We service the West End. The Ottawa General and the Ottawa Civic service the centre of Ottawa, and the Montfort services the eastern part of Ottawa. There's also Children's Hospital of Eastern Ontario, CHEO, and they provide mental health care to kids up until somewhere between 16 and 18 years of age. The Royal Ottawa is what's called a tertiary care hospital. They provide subspecialized care to complex and long-term, seriously mentally ill patients. So they have a particular role. We relate extremely well to all of the hospitals I've mentioned. We meet on a monthly basis, we plan together, we work and complement each other's, the jobs others do. But we do different things in different places. All of us then relate to the primary care mental health system, which would be addiction services in the community, family doctors, mental health agencies, counseling agencies in the community. So there is very much a system with primary levels, secondary levels, of which we are one, and tertiary levels, and we all need to be integrated, and we are.
Well, Andrew, we've toured the center together, and you pointed out some of the shortcomings of the unit. What are other physical improvements, plant improvements, if you will, that have to be made to meet the challenges you face?
So there are several things. When you consider points of access for mental health care, especially the acute care needs, most of our patients come in through the emergency department. If anybody's been to our emergency department, you know it's a very busy and very public sort of place. When you're in crisis, you really aren't provided any sort of privacy. You're made to come in and you'll sit there and wait a bit, as is common in emergency departments, and in acute crisis without a nice private sort of area to receive your care. As I said before, we're responsible for your security, and there are times where we post security guards if we have to, or we do whatever we have to do to keep you safe. But within the emergency department, we don't really have a place where we can provide a serene environment that's secure for you. In addition, for the other patients in the emergency department, if someone's experiencing an acute crisis and is behaving in a way they normally don't behave, it can be stressful to other patients in the emergency department. So a lot of issues in the emergency department. If you're accessing our outpatient services, here again, you'll be in a unit adjacent to our inpatient area that was built in 1976 and wasn't really purpose-built to provide care to mental health patients. So when you come to see a psychiatrist, you end up sitting in a fairly public hallway, actually, while you wait for your psychiatry appointment. So again, we're faced with an environment where you really don't get the privacy and sort of the comfort that you need when you're facing an acute crisis.
And Jerry, you talked in the past about, including in some of the media stories, about the need to begin therapeutic care right from the moment that that patient arrives at emergency, and then a continuum of care that may or may not require inpatient care.
Absolutely. I think it's fair to say that it's a minimum expectation that the people in our area deserve care that is welcoming and not stigmatizing. It is extremely difficult to reach out and seek help when you're having a mental health crisis. At the very least, you require trained mental health staff to see you in the emergency department. These are people who are used to dealing with, are trained to deal with people who are having mental health crises, and who are very professional, very confident, and really inspire some sort of confidence in the patient when they present. We also need dedicated space in our emergency department for people to receive that care, receive an assessment, to look at options to resolve their crisis, which may or may not involve admission. It may involve linking with community crisis services. It may just simply require time and perhaps urgent follow-up.
So let's come to the short strokes on why we're here today. Let's follow somebody from the moment they arrive in emergency with their family members perhaps, or perhaps escorted in some way, through to the treatments they'd receive and how things have to change to make it better.
Okay, so I'll start with that one as an emergency physician. So if you're in acute crisis, you may arrive in our departments with a loved one or on your own. You may arrive by ambulance, or you may be escorted by police. Either way, you're triaged at the front end to determine how urgent the care is. Most crises are very urgent, and we try to get them to see the physician as soon as possible. The emergency department's role is to make sure you don't have a medical problem that could be masquerading as a mental health issue, or that you don't have some sort of drug overdose or any other potentially life-threatening medical conditions. So we work on the medical clearance of these patients. You can expect to be enjoying the privacy of a curtain when you talk to physicians about your problems at times in the emergency department. It's our job in the emergency department to determine when you're medically clear if you need to see a psychiatrist or not, and about 50% of those that present with mental health issues do end up needing to see a psychiatrist. So once the medical clearances occurred and once we determine you need to see a psychiatrist, then we consult a psychiatrist who will come and meet you in the emergency department.
Talk about the privacy. You know, one of the things that, if you take a tour of the unit, you'll find that people who are in group therapy, for example, are in the same general room as families who may be visiting a loved one, and the need for privacy.
Yes. So we have a 24-bedded inpatient unit, and we are short of space by at least 50%. The unit, as Andrew mentioned, was started in 1976. It has not been touched or renovated since then. It is congested. There is not enough space to afford people privacy, whether it's in their room or when they're visiting with family or friends, or when they're being interviewed or in therapy sessions. Essentially, we have one large room where people eat, sometimes attend groups. We have a number of altered patient rooms with lots of stuff in them where psychiatrists try to interview patients. We have a congested area generally where people often have to line up to receive medications or line up to get attention from nursing staff. The whole thing adds up to an environment that is certainly not therapeutic and is in fact reinforcing stigma that people already feel who have mental health issues.
So let me call Melanie Adams, who is the president of the foundation, to come up and join us. Our leader in fundraising, and what a great job she has been doing in so many areas. The unit's physical environment is suboptimal, would be a euphemism.
It's a good way to describe it.
I'll describe it as shocking to some people who go there for the very first time. They say, what? This is not the Queensway Carleton Hospital I know. How do we get there, and how do we fix it?
So the mental health department was to be part of our last campaign fundraising initiative under Care Grows West. And as the needs in the rest of the expansion of the hospital continued to grow, the funding was diminished. And that was the area of the hospital that sadly had to be left behind. And so for people who aren't aware, the hospital receives funding on an annual basis from the government. And it's a fixed operational budget that takes care of salaries and supplies and services. But there is no additional funding available to the hospital for projects like this. So really and truly, if we want to make the difference, this is where philanthropy comes in. The role of philanthropy is to take adequate health care, which is a responsibility of our government, and raise it to excellent. And this is the best opportunity for us to demonstrate that.
I think it's really encouraging that the leadership of the Queensway Carleton Hospital has decided this has to be fixed, and we will get the ministry to come along, and we will set the standard in Ottawa for care. In the West End, we are the only hospital that delivers this kind of care, and they've decided to move ahead with the renovations and re-establishment of that as a priority area of the hospital.
This is, it's extraordinary leadership, I have to tell you, and I don't see this often. We talked yesterday, and I think when St. Vincent's was underway, that's how St. Vincent's moved along. It was the community and the leadership of the organization that said, patient and family center care is our focus, and it is our priority, and we're going to make this happen. Andrew, and you probably can speak a little bit about the process with the ministry at the moment.
So I think the first step to solving a problem is to admit that you have one. And in fact, as we became aware of the issues that faced our department, our board and senior leadership team have actually studied the problem quite extensively and have taken steps to try to start fixing our problems. We've actually commissioned an external study also that had a look at our program. You know, our staff is delivering very good care, but limited by the physical plant that we're in. So with this, our major issue at this point, or the major barrier to implementing change, is funding.
We have some families who are willing to share their story. Perhaps you'd introduce this next video, Melanie, so that folks can see how many of the families who have needed help have now decided to band together and make a difference.
First of all, I have to say, as many of you will feel this morning, some of the videos you're going to see are quite emotional, and they're powerful because they are our friends and our neighbors and our community, and people who have had real life experiences at our hospital and found what we delivered to be suboptimal have come forward and are sharing with us today. And the Sankmar family, I think, is one of the most beautiful examples of a family rallying on behalf of our community.
Early on, I would say that Matthew was an anxious child. Like, he worried about everything. It was a concern of ours. So we spoke to teachers and we spoke to family doctor, and everybody just sort of said to not to worry. We were just worried parents. And then when he went off to college, he wasn't looking well, and he didn't seem happy. And as a parent, you can tell when your child is well and when they're sick. And then we made the decision that we would try to bring him home. That was a really hard time when Matthew came home. And he didn't get out of bed, and he hardly ate.
Not happy all the time, pushing people away, never wanted to go outside. And I had buddies who would try to get me to go out and do things. I just wouldn't. I just was like, I had no desire to do anything in life. It was just like, I was like, if this is it, I'm done with it. That's kind of how I felt.
I don't think he really saw that anything was ever going to get better. And so I think he really thought, what's the point of just suffering all the time? And so we didn't know what to do, really. We were just at a loss. And then a friend of mine who suffered with some mental illness himself, he suggested to go to QCH and talk to somebody there.
Our family kind of has the attitude of something's not right, let's try to fix it. Getting involved and trying to make something better for somebody else is important to us.
If there's something that we could do to help another family to understand that they're not alone and they can get the help at a hospital, then we need to do that.
I think it's natural to just make sure that your family, gets everything out of life that they should get. And you want that for everybody. Matt's doing great. He's, kind of working himself through his issues, rebuilding himself. He's with us, and we're happy to spend time with him.
I didn't know how to express my emotions ever, so I never really did. It took me a long time to tell anybody how I was feeling. And you're not ready for what's out there, and you get really depressed, but you have to know that you're not alone. Like, there's a million people like me who feel depressed all the time, and like who feel lost and who don't feel understood, but we do understand you. It's just, I understand that the majority of people aren't going to understand what's going on, but there's always somebody who can talk to you, and there's always somebody who can understand what's going on.
My hope for QCH is that people that are struggling with mental illness will walk through those doors and feel like they have arrived at the right place, that this is a safe place, it's a positive place, and a happy place, and a place full of hope. I know what we need to do, and it starts with hope. I hope you'll join me.
There we go. We know these stories. We know these people in our community, and I dare say that a lot of these stories take place in our own living rooms all across West Ottawa. We've just heard about the increased demand for mental health services, and the challenges are on a national level. It's almost overwhelming to consider how to fix the crisis and the problem. Locally, the Do It for Darren campaign, the Bell Let's Talk initiative, and my colleagues at the Royal with You Know Who I Am have done an incredible job in moving the yardstick forward in terms of reducing stigma. Thankfully, men, women, and children are coming forward and asking for help. Indeed, the plug is out of the dam, but the waters are rising. Mental health is a priority healthcare issue, and at QCH, we have a unique and critical role to access mental health, and it is a priority for our hospital. While we cannot possibly fix the entire system, we can fix what we have to at QCH. We have a responsibility and an accountability to do that. We know what we need to do, and it begins with hope. Today, we launch our $5 million Hope's Rising campaign. And hope was a word that was used with every family that we spoke with. At QCH, our hope is that our community will rally together and raise these funds needed to make the necessary changes. Our hope is for increased capacity and access to acute care for our friends and families when they need it. Our hope is that families will have confidence in QCH when they depend on it. Our hope is to provide an environment that supports healing and wellness and recovery. Our hope is to provide dignity for families and patients when they truly need it the most. I'm going to introduce a few people now, and when I ask you to stand, if you would stay standing, please, until we finished all the introductions. Sandy McDonald isn't able to be here today, but Sandy would have been representing Bell. She didn't make it in because of the storm. But we'd like to thank Bell and their Let's Talk program for leading the way to reducing stigma. They've done an incredible job. I'd like to introduce Tom Schomburg, our hospital president and CEO. This campaign really is about hope, but it's also about incredible leadership, as I mentioned earlier. With no current promise of additional government funding, Tom is standing in bold leadership by committing to make the changes necessary for a mental health refurbishment at QCH. He's committing to a project of huge magnitude, and it's based 100% on philanthropy. This is an extraordinary demonstration of leadership. Thank you, Tom. I'd like to introduce members of our foundation board. Al Whitten is our chair, and members of the board who are here today, if I could ask you to stand for a moment with us. Thank you for your leadership. Thank you for believing that this community can rally together one more time for such an important cause, and for taking on the accountability of this $5 million project. This morning we have a team of psychiatrists and mental health specialists from the unit, and I'd ask you to join us as well, please. Thank you for your professional leadership, the work that you do every day in caring for our loved ones. This project has been a long time coming. It's here, and we thank you for your patience. And these projects don't happen without a whole bunch of heart. And I am so proud to work with a committee who has the heart and soul and the bravery and the courage to stand forward with us and make this happen. And so I'd like to introduce to you our campaign chair, Ron Prehogan. Our wonderful honorary co-chairs, Chris and Aaron Phillips. Pillars of our community, Sarah, Kevin, and Matthew Sankmar. Beloved to QCH, Kathy Turner and Dennis Dow. A rallier for so many causes, Stephen McGill. A strong advocate for mental health, Ken Hopner. And of course, Doctors Andrew Felkner and Dr. Jerry McNestry. They know what we need to do, and it begins with hope. Thank you. So now I'd like to introduce a member of our committee that probably doesn't need a lot of introduction. By way of this video, I'd like to present Barbara Crook. She's here representing the Greenberg family and Dan Greenberg today, and this is the best example of inspirational leadership.
Mental health and mental illness has been a big part of my family since I was a child. When I was 4 and my sister was 6, our father developed a severe depression. He ended up in a psychiatric hospital in Montreal for several weeks or months. It's a little vague for me because I was so little, but I just knew he was away on a business trip at the time. That's what I thought. And the most recent experience, and the one that is connected to the Queensway Carleton Hospital, is that 2 years ago, a close relative developed symptoms of bipolar disorder very, very suddenly. And I was lucky because of my work as a mental health advocate, and because I'd done a lot of reading, I knew the symptoms right away. And I was able to take the person to the Queensway Carleton Hospital and get her admitted to the mental health unit. And that was a real roller coaster of an experience. First of all, to take someone you love to a hospital, to know they're not well and that they need to be here, but to have to leave them behind a locked door was an experience that I wouldn't wish on anybody in their lifetime. But the treatment was really good. She had a fantastic doctor, Kathy Kovacs, and who is just a wonderful human being and a tremendous psychiatrist. The facility, on the other hand, left a lot to be desired. It's very old. The existing facility is very old. So I felt very, very strongly that while the care was good, the facility was really, to pardon the pun, it was very depressing. What really excites me about the plans for the Queensway Carleton mental health unit is that it starts in the emergency room. They're going to be taking care of the patient from the moment they enter the hospital, so that it minimizes the risk to that person and helps the healing start right away, and that it minimizes the disruption to other patients, because they're here, the other emergency room patients are here to get taken care of, and their health is also important, and it can be very, very upsetting to see someone in a mental health in a full crisis. I think when you are experiencing mental illness yourself, for example, in the times of my life that I experienced severe depression, or knew that it was severe enough that I couldn't work through it without some help, you feel absolute despair. Intellectually, you can often understand that this is going to be okay, I'm doing the right things, but there's something that it's almost in your soul that just feels that there is no hope. The more we talk about our personal experience with mental health and mental illness, especially people who are in the public eye, the more it gives hope to other families. I think when you're experiencing it, especially as a person alone, you somehow think, nobody else has ever gone through this before. There's something wrong with me. There's something wrong with my family. I shouldn't be feeling this way. There's a self-stigma. I should not be feeling this way, and people will judge me. The more we talk about mental health, and the more we make it acceptable for others to talk about mental health and mental illness, and the more we share our stories, I think that gives hope to everyone around us. I'm Barbara Crook. I know what we need to do, and it starts with hope. I hope you'll join me.
Ladies and gentlemen, Barbara Crook.
Thanks very much. Thanks to everybody for coming, despite the snowstorm and the lack of parking and the other challenges. A special a special shout out to Melanie. There, as she says, there has been great leadership in this project, in this campaign, and getting this happen. But I really have to give Melanie special credit for really listening to the patients and their families, listening to the families you've heard today, all of whom got good treatment, but really felt that more could be done. And she just said, this is going to happen. And she listened to us, and we felt respected and cared for, and we still do. So thank you, Melanie, for that. Now, is there a possibility of getting light so I can actually see my speech? Or I'll just wing it. Just a little bit of light. I already dropped it in the snow, so it's a little blurry anyway. Okay. The video you just saw tells only part of the story of getting my relative, we'll call her Jennifer, admitted to the QCH mental health unit as an inpatient in November 2013. Oh, that's better. Thank you. I had friends who were bipolar. I had talked about my struggle with depression and my family history of depression. I had done speeches about the need to stop stigmatizing people with mental illness, which is indeed a no-fault disease and not a failure of character. But nothing could have prepared me for watching a vibrant, successful, and caring person go from what seemed like merely a bad spell of insomnia to full-blown mania and psychosis in less than a month. The accusations, the inventions, the bizarre behavior, the revelation of details of her private life that would shock anybody who was there. The specific details of Jennifer's story are not mine to tell, but I can say that thanks to Dr. Kovacs and her team and some very hard work by Jennifer that continues to this day, we have our old Jennifer back. What I can talk about and want to share with you today are some of the very tough realities of being a psychiatric inpatient. You automatically lose your privacy and most of your dignity. You lose the right to make decisions for yourself. You're issued tiny towels that wouldn't dry off a Barbie doll, even the new curvy Barbie. And that's so that you can't use the towels to strangle yourself. You have to ask permission for just about everything, including the supervised use of a blow dryer or a mirror or anything else that could cause harm to you or other patients. You often don't understand why you're there, especially if you're on a manic high and can't understand why no one else wants to bounce off the walls with you. And sometimes if you ask too many questions, you're considered difficult and can be shut down with a hand in your face. You're often awakened in the middle of the night by a roommate's nightmares, by the outbursts of a violent patient, or by the sounds of the police bringing in a new patient who is totally out of control. You're glad to hear that a fellow patient has a weekend pass to go home, then devastated when that patient returns early with a bandage around her neck because she tried to commit suicide the minute she was left alone. If you do get privileges to go to Tim Hortons for coffee or a snack, you see how bright, shiny, and new the rest of the building is. Then you get locked back into an old, dingy ward that was never designed for the needs of the mentally ill. Even something as simple as getting the wrong meal, which I gather is not a rare event at the Queensway Carleton, was enough to convince many of the patients I met that they weren't considered important, and it reinforced what we call their self-stigma. Maybe I'm really not worth it. Maybe I don't deserve the best care. Maybe I'm not going to get better. These are all things I witnessed or was told about by the patients. And I know from talking to other families that psychiatric outpatients have many of the same challenges, including the loss of privacy and dignity. Now, the reality is that for their safety and the safety of others, we can't give psychiatric patients most of the freedoms that we take for granted. They have to be watched, and they can't have access to things that might harm them. But we can create a physical environment and a proper design to help patients feel safe, listened to, taken care of from the moment they enter the hospital. That's why the Hopes Rising Initiative, and this is why I'm so excited, the Hopes Rising Initiative will include changes to the way psychiatric patients navigate through the system, starting right in the emergency ward, so they won't be a danger to themselves or to others, and so they won't feel as if the darkest moments in their lives are being played out in public. It will create a safe, bright, welcoming space that's also secure and comforting. And the design includes a separate area where violent patients or late-night admissions can be taken care of without disrupting the entire ward. My husband Dan Greenberg and I have been proud to support several mental health initiatives in Ottawa, including the new brain imaging equipment at the Royal Ottawa Mental Health Centre. But as we heard earlier, and something most people don't realize, which is why I'm repeating it, is that the Royal does not have an emergency department to deal with patients in crisis. So if you live in the West End or in the Ottawa Valley, the Queensway Carleton is where you come for immediate psychiatric help. That's why Dan and I are pleased to announce today a gift of $1 million to the Hopes Rising campaign. Dan is very modestly sitting down over there. We believe that the true measure of a society is how it takes care of its most vulnerable members. Oh, I almost got through. That includes those with broken spirits and broken minds who can't advocate for themselves until we give them the tools and the space to heal, and until we treat them with respect and compassion. I'm going to leave you with the words of a wonderful woman named Victoria Maxwell. She's an actor, teacher, speaker, and educator who has lived with bipolar disorder for more than 2 decades. This is what she says. Please don't forget that just like you, I have a heart that hurts when someone judges me for something that isn't in my control, when someone doesn't see that really I'm doing everything I can to get well, even though it doesn't look that way. No matter how crazy I may be, I am aware. And when your heart remembers that, my heart does too. Dan and I would like to thank you for opening your hearts to the stories of people in our community who have been affected by mental illness. And we invite you to join us in supporting the Hopes Rising campaign, to give hope to patients and families who are dealing with mental illness, and to make the Queensway Carleton Hospital a leader in turning their despair into hope. Thank you very much.
Powerful, inspirational leadership. We will do this, and it's going to feel like a warm hug to so many people who are coming through that unit. And there's over 700 patients every year that spend more than one night in the unit. And as much as I'm humbled and inspired and thrilled and proud to say thank you to Barbara and Dan, I think that it's most appropriate that it comes from a patient and a family who have experienced the unit firsthand and who are beloved to our community, who are here today to share their story and their expression of gratitude to Barbara and Dan, because they know what it feels like.
We were dealing with one of my daughter's addiction issues and her mental health problems. And it went on for a couple of years, up and down, looking like she was dealing with it. And then it all fell apart and she died. Thinking about Haley ruminating over her and drinking far too heavily. This all culminated in my attempted suicide. I'm lucky to be here. I'm also lucky that everybody was there for me, not just Kathy, but this hospital. And we see the need for the revamping and rehabilitation of this unit.
Mental health needs a spot on its own so that you have that safe place. Dennis's children came to see him, and there was no place for them to talk to their dad about what had just happened. We need this.
To allow the Queensway Carleton to provide the right environment for our mental health patients to heal.
And when you're struggling, you need that. You need to be able to feel better, not more introverted. Going into yourself, being frightened and afraid and getting more depressed. You need to be in an environment that's going to bring you out of that and help you. A lot of people don't even know that our mental health unit is one of the few in the city that's an emergency unit where you come in and you are admitted. We need so much help here to bring the mental health facilities in this center of excellence, in this hospital, up to par with everything else that we do here.
We've survived and have come out of this. We're stronger individuals for it. And we're only there because of our community and our community hospital and each other.
So Hope's Rising, yeah, what a great name. That's what it is. You know, since 11 months ago when this happened, I've been wearing a bracelet that says Hope. And what an accurate name for this campaign, because when you've lived through what we have the last couple of years, all you have is hope. That's what you have. That's what you wake up with in the morning. You hope it's going to be a better day. We know what we need to do, and it starts with hope.
We hope you'll join us.
I am so glad Dennis is here with us today. Dennis Dow and Kathy Turner.
Good morning. It's a big room. Dennis and I have been given the privilege of thanking two very special people for their incredible generosity once again to our hospital. Barbara Crook and Dan Greenberg, we are so grateful for all of your achievements and thankful for the difference you have made and continue to make in countless lives along the way. We thank you for the hope that you will bring to so many with this gift. As we express our gratitude, we must never forget that the highest application is not to utter words, but to live by them. You see, we're put on this earth not to see through people, but to see people through. And Dan and Barbara, that's what you always do. Hope is rising. You're both much loved in this community, and we can't thank you enough for everything from our hearts. Thank you.
Good morning. You know, I wouldn't be standing here before all of you this morning if it wasn't for, well, Kathy in particular, but the whole community. Family, friends, co-workers, my employer, Melissa, thank you. Well, I was fine till I got up here. Excuse me. You know, I've never been shy about public speaking. Those of you who know me know I do like to talk. Just not about myself and my feelings, and this was a problem in my very personal story. I don't know what it takes to get someone like me to talk before they become self-destructive, but I do know it will continue until we are as comfortable discussing mental health as we are about heart disease, cancer, or any other health issue.
Many suffering with mental health issues now have the courage to come forward and seek help thanks to initiatives like Bell's Let's Talk Day and the Do It for Darren campaign. This unprecedented demand has pushed our mental health units beyond current capacity. We are talking, but now we need to act. As you've heard from everybody so far, our unit was built in 1976 with minimal changes since. I can tell you from personal experience that it is very lacking and is not conducive to healing. The doctors, nurses, and staff were terrific, but they can only work with what they have. Kathy, in saving my life, spent days in emergency and saw firsthand the need for a separate mental health unit there. A patient being treated for a heart attack should not have to lie beside someone who has experienced a psychotic break, as I was. Kathy and I are very private people, and it has not been easy for us to bare our souls to everyone. As I know it has not been easy for Barbara, Sarah, Matthew, and Kevin. Kathy and I are doing this because we feel so strongly about the need to renovate the mental health unit at the Queensway Carleton Hospital and ensure that patients are receiving optimal care when needed. If we can help just one person find peace, get well, be safe, and have a better life ahead of them, then our decision to speak publicly will have been the right choice for us.
We know what we have to do, and it starts with hope.
We hope you'll join us.
Thank you, Kathy and Dennis and the families who've shared their stories today. Thank you to the St. Mars family and to Barbara Crook for sharing their very personal stories this morning. And thank you to all of you who took time away to be with us here today. I mentioned earlier you were asked to join us because you are visionaries. You see a problem. You seek a solution, and you take action. Over the next few days, you will receive a follow-up phone call. And that call will be to ask you to join our army, to make sure that in the west end of Ottawa, hope's rising. Thank you for being here. Drive safely.